I was elected 2 years ago for the first time in the United States Congress. And I think that I was elected on the same message that you all in Fauquier sent when you sent Frank Wolf back to Washington. That is, the federal government is borrowing 40 cents on every dollar it spends. Now stop and think about that for a moment. The federal government is borrowing 40 cents on every dollar it spends. We have accumulated a national debt of $16 trillion. $16 trillion. We've got to get it right. If we don't get our spending under control, if we don't do that, it's going to be 5, 10 years, and that's what economists tell us. I mean, I'm not an economist, but I know that you don't have to be an economist to know you can't borrow 40 cents on every dollar you spend and not be headed over a cliff. And that's where we're headed. This is going to be an election where I hope when it's over, we can all say, each one of us can say, that there was a time when it looked like the future for our children and our grandchildren was in jeopardy. There was a time when it looked like the future for our children and grandchildren was in jeopardy, and we did our part. That's our charge. Thank you. Love being in Fauquier County. Look forward to Election Day and a big victory on November 6th. Thank you.
I mean, if you look at the federal budget now, the large majority of it is driven by Medicare spending, Social Security spending, debt payments, and Medicaid. Those are the four things that drive our spending in this country. And so we really have got to focus on reforming those programs, or else they're going to die under their own weight. I mean, that's the bottom line. If you're familiar with the Ryan budget plan and the Ryan Medicare reform, what you're talking about is instead of a healthcare system that caps services with this independent panel advisory board, it is a combination of a number of things, but it's driven by having more competition among insurance companies, which that competition necessarily would drive rates down, drive the cost of health care down, so you end up having lower costs but higher quality health care. What are the other things that we can do to drive down health care costs? You allow insurance companies to write policies across state lines. You enact true tort reform so that you reduce those costs. As far as Medicare goes, you have a system that invites the private insurance company in to compete for the Medicare business, like Medicare Advantage, which, by the way, is being gutted by the president's current health care plan. When you have that competition, I would submit to you that you're going to have lower costs, greater choice, and not have the government running